I've seen a lot of different situations where we had an advance directive in place and a loved one unfortunately had a massive car accident or a massive stroke, and it was so much better for the family members to have in writing or have had that conversation with their loved one so that the steps moving forward, it wasn't a tremendous weight on the family to have to make that decision because they knew what their loved one wanted.
I think right now we've seen very heartbreaking cases where we're calling family members to inform them that things aren't going well and asking questions about the plan of care. And family members are saying with their hearts breaking, we never had that conversation. We never discussed this before. And this is a chance up front to say, before things get bad, while we continue to hope for everything to go well, let's discuss how to address the worries. Let's discuss how you'd want to be taken care of if things did get worse.
Ask yourself the question of, would you want your loved ones to have to navigate those difficult decisions without ever knowing what it is that you would want? Advanced care planning is an avenue, is a vehicle to connect with our loved ones at a very, very deep level. Is it comfortable? Not always.
So none of us know what our life is going to be tomorrow. There's going to be uncertainty in life. Unfortunately, when we're diagnosed with serious illness, a significant proportion of us will not be able to speak for ourselves.
Advanced care planning is just that. It's really just making plans in advance of actually needing them.
There are lots of documents under the umbrella of advanced care planning. In my opinion, the absolute most important piece is the medical durable power of attorney.
Medical durable power of attorney, or a healthcare surrogate, basically is just about you picking who you would like to be your decision maker if you can't make decisions for yourself. To designate that person in writing doesn't have to be done by a lawyer. It can be just simply written on a medical durable power of attorney paper.
So when you're choosing a medical power of attorney, it does not have to be a family member. It does not have to be somebody that everybody expects it to be. What is the most important about choosing a medical power of attorney is that you choose somebody that you trust, you choose somebody that you're willing to share your wishes with, that you are willing to have the tough conversations with, and that you believe will be that advocate for you if and when you are unable to make your own decisions.
When patients do not have advance directives in place, it can be very difficult for the medical team to really know how to best care for the patient.
So that the medical system really knows how to do right by you. Make sure your voice stays lifted to the top.
So in Colorado, we have what's called a PROXY law. If you haven't designated a medical decision power of attorney, the decision process, if you are unable to speak for yourself as a patient, becomes the medical team finding a proxy for you. What this means is we reach out to all interested parties. This is really tough because sometimes, your friends and your family may not like each other. They might have different opinions on who should be speaking for you and what they should be saying. And in that case, your care can be delayed, and you might not guarantee that the care you want is what you're getting.
I think it would be more helpful if more doctors could talk to you about it.
I think that we've stigmatized advanced care planning to really the last several chapters of life, when in reality I think it would be a beautiful world if everyone who walked into a hospital system had the person that they wished could be their voice.
And I see now, as a physician, families having these conversations more than ever. Mostly to say, this is what I would want, or this is what I wouldn't want in these various situations. But also these conversations are leading to deeper conversations about what matters most in life and how we as a family or as a unit, how we express love to one another. These conversations actually lead to something much bigger than just putting a bunch of care plans down on a piece of paper. It leads to an exchange that helps us to understand how we support one another as human beings.
Your life really is about planning your life, not planning your death. It's about planning to make your life comfortable, and teaching your kids to do that. I was really proud of my dad because he had a plan, and it really takes pressure off your loved ones when you plan.